This is WAMU 88.5's Morning Edition. I'm Matt McCleskey. Good morning. 1 in 4 people who call 911 for emergency medical help in D.C. are not actually having a medical emergency. So starting today, the dispatcher won't automatically send an EMT or paramedic to respond. Joining me now to talk about a new program that will connect some callers to a triage nurse instead is D.C. Fire and EMS Chief Gregory Dean. Chief Dean, good morning.
Good morning.
Thanks for joining us. Well, first, how many calls does the district's 911 system get, and why are so many of them from people who don't have a true medical emergency?
On average, we get about 500 calls a day, and about 24% are non-life threatening. This is something that's gone on in the district for a very long time, so it's pretty natural right now for people to call 911 and ask for assistance. We've been transporting a lot of non-emergency patients that actually would do much better if they were seen in a clinic.
Well, how did you decide to add a triage nurse to the equation?
When Dr. Holman, our medical director, came on board, he came from private practice, and he recognized that a number of his patients that we were seeing really did not need to be seen in the emergency room. So he started working with an assortment of healthcare collaboratives around the city, looking at how we can address this problem. Coming out of that was the ideal that we should put together a nurse triage line that would allow us to look at patients that were non-life threatening and be able to find assistance for them without putting them into the emergency care. At the same time, it would free up our resources so that we could take care of critical care patients and also have room for them in the emergency room.
Explain the sequence of events, how it'll happen under the new system. Someone calls 911, the dispatcher answers the call, and then what?
They'll make a determination, should we send a resource, be it a paramedic or our emergency medical technician, or is this patient non-life threatening, such as a headache, things of that nature, sprained ankle, that they would send the call to the nurse triage line. The nurse will be a registered nurse by the Department of Health. She will interview the patient. She'll make a determination if this patient is a good patient to go to the clinic, or if she should send them back to the 911 for immediate care. At that time, if the patient goes to a clinic, she will call the clinic. She will make an appointment for the patient. She will tell that to the patient and transfer them.
Just to be clear, who should call 911 and who shouldn't?
Everybody can call 911. We'll triage what you call us with, and we'll make a decision what would be the correct resource for you.
In the past, D.C. has always guaranteed transportation to a hospital for anyone who calls 911, so that's no longer the case. That's a pretty big change.
It is a big change. The reality is that you can't use the same level of care for everyone. So the idea behind this is that we will triage what's going on and make a decision as to what's the right care for everybody.
So it could result in less crowded emergency rooms. What are the benefits for your department, D.C. Fire and EMS?
It allows us to have units available for critical medical emergencies. And for the patient, it allows patients to connect and get their own primary care doctor versus going to the emergency room.
Seems like a lot of responsibility, though, for a dispatcher or a nurse to tell over the phone if someone is having a real health emergency. How are you going to guard against someone making a mistake?
These nurses have higher training than our paramedics and our dispatchers, than our emergency medical technicians. They'll be the ones that will be talking to the patient, making that medical decision. When in doubt, we will send resources. But if the patient, the symptoms and what they're saying are what we consider low acuity, non-life threatening, then we think it's safe to be able to have them go to the clinic.
D.C. Fire and EMS Chief Gregory Dean, thanks so much for joining us this morning.
Thank you.